Number 1. Dual-acting osteoporosis drug.
Suffering from the bone-weakening disease, people with osteoporosis are at risk of a broken bone with the simplest task. Daily activities like walking or lifting a grandchild can become a concern for injury. Unfortunately for millions, loss of bone occurs silently and progressively, often without symptoms until the first devastating fracture. Since 1995, drug therapy for the condition was limited to anti-resorptive agents, medications to slow down bone loss. In 2002, anabolic medications became popular, acting to increase bone formation by stimulating the cells that build bone. The stimulation seen with these anabolic medications, however, increased bone resorption as well, mitigating some of their reinforcement effect. But a new drug is remedying this catch-22. FDA approved in April, patients receive 2 injections of romosozumab every month for a year. The treatment works by blocking the protein sclerostin, which inhibits bone formation. This allows an increase in new bone, while also decreasing bone resorption or bone breakdown. These developments present a new agent that builds more bone than any previous osteoporosis drug. In an active comparative study of women with postmenopausal osteoporosis receiving the new drug, or its anti-resorptive predecessor, risk of spine and hip fracture in the new drug cohort was reduced by 50% and 38% respectively. Patients are getting back to daily activities without risk. The treatment is providing strength not only in bones, but in spirit.
Number 2. Expanded use of minimally invasive mitral valve surgery.
1 in 10 individuals over the age of 75 will suffer from mitral valve regurgitation, also known as mitral regurgitation, or MR. It is a condition where blood leaks backward through the opening of the mitral valve into the left atrium, placing extra burden on the heart and lungs. The diagnosis also brings worry of major surgery and months of recovery. While the situation is unnerving, minimally invasive surgery for mitral valve repair was introduced in 2013. But until now, the innovative transcatheter device for repair was only approved to treat mitral valve regurgitation in individuals with primary MR, who were not eligible for open heart surgery. In March, the FDA broadened its approval of the device to include patients with secondary MR as a result of an enlarged left ventricle. The newly expanded use targets patients who have failed to get symptom relief from other therapies. This expanded use of the minimally invasive method is bringing relief to more patients by removing some of the risk, fear, and inconvenience associated with cardiac surgery.
Number 3. Inaugural treatment for transthyretin amyloid cardiomyopathy.
Heart failure and atrial fibrillation are 2 of the most common cardiac diagnoses of the elderly population. Though previously underdiagnosed, it is now clear that a condition called amyloidosis is an important cause of both of these conditions. When amyloidosis affects the heart, it is known as amyloid cardiomyopathy, a progressive and potentially fatal disease that results from destabilized transthyretin, a transport protein. It becomes misfolded and forms amyloid fibrils that deposit into the walls of the heart, stiffening the muscle, eventually leading to heart failure. Until now, treatment for the condition has been limited to transplant. In May, an approval brought hope to these suffering individuals. 2 drug formulations of the compound known as tafamidis have been dubbed the first ever treatment for the 2 subtypes of the condition, hereditary and wild type. Phase 3 clinical trial results show a 30% reduced risk of death in patients receiving this breakthrough therapy. The approval of a drug for these conditions effectively highlights the importance of providing a treatment option where there once was none.
Number 4. Therapy for peanut allergies.
Turning a doorknob, sitting with friends at lunch, eating out. Some everyday actions can be life-threatening for a child with a peanut allergy, not to mention parents living with anxiety with every move their child makes and every bite their child takes. But a new immunotherapy is bringing fascinating data and hope to the food allergy arena. In September, an FDA expert panel recommended approval of a first-of-its-kind treatment. a capsule with a minuscule amount of pharmaceutical-grade peanut protein. Over time, the dose is increased, and the child builds up a tolerance to peanuts. In a recent study, nearly 80% of the patients reached a daily maintenance dose, the equivalent of 1 peanut. Though not a cure, the breakthrough treatment lessens the worry of accidental exposure, easing the minds of parents who live in constant fear.
Number 5. Closed-loop spinal cord stimulation.
Chronic back and leg pain. Sufferers toss and turn at night and cringe through daily activities. Hesitant to take opioids, some patients undergo spinal cord stimulation, or SCS. It works by sending electric impulses along the spinal column through an implanted spinal cord stimulator, reducing the pain signals that reach the brain. However, each patient is prescribed a fixed output or consistent dose of stimulation, not taking the individual's movement into account, decreasing its effectiveness. The innovation of closed-loop spinal cord stimulation provides a solution. The closed-loop system uses a stimulator able to communicate in real time with the spinal cord neurons. It is the first to measure the cord's response to stimulation and adjust every pulse according to activity. With this technology, patients are getting measurable pain relief, sleeping better, and taking less medication. Pending approval, closed-loop stimulation could be a saving grace for chronic pain patients everywhere.
Number 6. Biologics in orthopedic repair.
One twist, a pop, and the dreaded ACL tear means months or even years of recovery. Anywhere between 5 and 40% of patients may never return to their sports or daily activities. And for those who do, there is a 20% chance of re-tearing the anterior cruciate ligament. There is hope for better long-term results using the patient's own tissue and immune system with biologics in orthopedic repair. These cells, blood components, growth factors, and other natural substances replace or harness the body's own power to promote healing and decrease inflammation. The new technique uses a sponge injected with proprietary biologic factors in combination with the patient's own blood to stimulate healing of the ACL, preserving tissue rather than cutting it. A trial using this procedure is ongoing. Other potential uses for biologics in the orthopedic arena include its use in rotator cuff repair and as a coating for implant devices to reduce the risk of infection. Biologics hold the potential to provide every orthopedic patient a more natural, more effective, speedy recovery.
Number 7. Antibiotic envelope for cardiac implantable device infection prevention.
Pacemakers and defibrillators are life-saving electrical marvels, but do not come without risk. Infections occur in 1 to 4% of cardiac device implantations and can lead to a 25% one-year mortality rate. Treatment costs average around $60,000. Until now, giving the right antibiotics right before the procedure was the best and only proven way to prevent infection. Despite this, infections continue to occur. The recent innovation of an implantable antibiotic envelope ensures delivery of 2 antimicrobial drugs locally in the pocket for 7 days after implantation surgery. The week-long release of the drugs minimizes the risk of infection. The absorbable envelope received FDA clearance in 2013, but healthcare professionals were awaiting results from the landmark worldwide randomized RAPID trial. The findings, published in March, show a 40% reduction in major infections, making cardiac implantable device procedures safer for patients.
Number 8. Bempedoic acid for cholesterol lowering in statin-intolerant patients.
High cholesterol is a major concern for nearly 40% of American adults. The fat-like substance is necessary for the body to function, but too much low-density LDL cholesterol can lead to buildup in the blood vessels, which can cause a heart attack or stroke. While several medications exist for treatment, statins are the most popular, but the prescription comes with some adverse side effects. Statin drugs enter muscles, causing muscle pain in approximately 5 to 10% of people who take them. A new agent, bempedoic acid, has been designed as a once-daily oral therapy, given in addition to a patient's current cholesterol medication regimen. Like statins, bempedoic acid works by blocking a key enzyme used by the body to make cholesterol. But unlike statins, it cannot accumulate in muscle, reducing the likelihood of muscle pain. In clinical trials of the therapy, patients saw their LDL levels drop by an average of about 25%. If approved by the FDA, bempedoic acid could be another addition to the arsenal of cholesterol-lowering treatments available to patients.
Number 9. PARP inhibitors for maintenance therapy in ovarian cancer.
The diagnosis is never easy to hear. It is a battle within the body. With ovarian cancer, cells in the ovaries grow very rapidly, creating damage to DNA. There is an enzyme designed to fix this damage, poly-ADP ribose polymerase, better known as PARP. But fixing the DNA allows the cancer to grow. Using a PARP inhibitor blocks the enzyme from repairing the damage in cancer cells, representing its usefulness in cancer treatment. In 2018, the FDA approved the first PARP inhibitor as a maintenance therapy after a first line of chemotherapy in women with BRCA gene mutations. Until now, maintenance therapy, the use of a therapy to prevent or delay cancer's return after achieved remission, hasn't been widely explored in cancer of the ovaries. Results from a study released earlier this year showed a 70% reduction in the risk of recurrence at 3 years in the group utilizing the approved PARP inhibitor. Researchers hope that PARP inhibitor use will show improved long-term outcomes, arming women for the fight against ovarian cancer.
Number 10. Drugs for heart failure with preserved ejection fraction.
Pumping blood 24/7, your heart takes no days off. It is, however, prone to an array of conditions that can affect its function. Heart failure with preserved ejection fraction occurs when ventricular muscles contract normally, but are thickened and stiff, impairing relaxation. The left ventricle is unable to properly fill with blood, leaving less available to be pumped out to the body. Current recommendations for treatment are directed toward accompanying conditions and symptom relief. It is common to treat high blood pressure and coronary artery disease, or encourage weight loss and quitting smoking when applicable. But a class of medications used in the treatment of type 2 diabetes is now being explored for heart failure with preserved ejection fraction. Sodium glucose cotransporter 2, SGLT2 inhibitors, are drugs that prevent the reabsorption of glucose in the kidneys, lowering blood sugar and reducing excess fluid. SGLT2 inhibitors became an agent of interest when they showed reduced risk of cardiovascular death and heart failure hospitalization in a cohort of patients with type 2 diabetes. Later explored in individuals with heart failure and reduced ejection fraction without diabetes, the inhibitors showed similar results. Research is ongoing but promising in patients with preserved ejection fraction. With an FDA decision anticipated in 2020, these drugs, among others, are introducing potential new treatment options for patients with this heart failure subtype.